Every day, cardiac surgeons witness something that challenges the assumptions many of us hold about the safety of the medications we take. Hearts that should be strong and resilient are arriving in operating rooms with patterns of damage that seem inexplicable, with electrical rhythms that appear suddenly and dangerously, and with tissue changes that cannot be explained by traditional risk factors alone. When surgeons trace back the patient histories, a recurring pattern emerges. Certain medications are repeatedly present, prescribed not recklessly, but with the intention of improving quality of life, reducing symptoms, or preventing complications. This observation is both alarming and enlightening, because it reminds us that medications, while designed to heal, are biologically active substances with far-reaching effects that extend beyond their immediate target. Understanding this dynamic is critical, particularly for older adults whose bodies respond differently to chemical interventions and whose cardiac tissue may already be vulnerable to subtle stresses accumulated over decades of life. The first point to consider is the prevalence of these medications in daily life. Drugs for heartburn, chronic pain, sleep disturbances, and other common conditions are prescribed millions of times each year. Their use is so routine that many people assume them to be inherently safe, often overlooking the fact that safety profiles are not absolute and can shift based on age, dosage, coexisting conditions, or prolonged use. Proton pump inhibitors, non-steroidal anti-inflammatory drugs, certain sedatives, and long-acting opioids, for example, are frequently prescribed to older adults, yet research indicates that these very medications can increase cardiovascular risk, sometimes dramatically. In one study involving over 500,000 patients, a single commonly prescribed drug was associated with a 65% increase in cardiovascular death, a statistic that demands careful attention. These numbers are not just statistics. They represent real human lives, subtle physiological changes accumulating over months or years, and the often unrecognized stress placed on the heart by substances taken with the expectation of protection or relief. The second point is that the mechanisms by which these drugs influence cardiac health are diverse and complex. Some medications interfere with electrical conduction in the heart, increasing susceptibility to arrhythmias. Others affect vascular tone, altering blood pressure regulation, or promoting unintended constriction or dilation of arteries. Certain drugs may contribute to fluid retention, metabolic stress, or inflammation, all of which place additional load on cardiac tissue. Older adults are particularly susceptible because the aging heart is less resilient to stress, with changes in myocardial elasticity, conduction pathways, and autonomic regulation that magnify the impact of these pharmacological influences. This is not to suggest that these medications are inherently malevolent, but rather that their effects are multifaceted and sometimes unpredictable in the context of long-term repeated use. The heart, a continuously active organ, responds to subtle biochemical shifts in ways that may only become clinically apparent after prolonged exposure or in combination with other risk factors. A third observation is that awareness and monitoring are often lacking. Patients may not realize the full implications of the medications they are taking, and even physicians may not always account for long-term cardiac effects when prescribing drugs that are generally considered safe. This gap in knowledge underscores the importance of vigilance, both in personal health management and in the medical community. Understanding which medications have been associated with increased cardiovascular risk allows for informed discussions with healthcare providers. Patients can ask critical questions about alternative therapies, dosage adjustments, and monitoring strategies. They can weigh immediate benefits against potential long-term consequences and participate actively in decisions that directly affect their cardiac health. This level of engagement transforms medication use from a passive act into a proactive and empowered practice, where each prescription is carefully considered in the context of overall wellness and longevity. A fourth consideration involves the cumulative and often subtle nature of medication-related cardiac stress. Unlike overt trauma or acute events, the effects of these drugs frequently accumulate slowly. Micro-level changes in cardiac tissue, electrical conduction, or vascular integrity may not trigger immediate symptoms, but can gradually weaken the heart's resilience. Over time, the risk of arrhythmias, heart failure, or ischemic events increases, sometimes manifesting in ways that are difficult to trace back to a single cause. This delayed presentation highlights the importance of regular cardiovascular evaluation attentive monitoring of heart rhythm, and a critical review of all medications taken over time, particularly for older adults who may be managing multiple prescriptions simultaneously. Awareness of these patterns allows individuals and clinicians to intervene proactively, adjusting treatment plans before subtle changes escalate into serious events. Finally, this issue speaks to a broader principle about the intersection of medicine and human biology. Every intervention carries the potential for both benefit and unintended consequence. Medications are powerful tools that can alleviate suffering, manage chronic conditions, and enhance quality of life. But their effects are rarely isolated to a single system or symptom. The heart, in particular, is uniquely sensitive because it operates continuously, responds to chemical and neural signals in real time, and integrates stress from virtually every other organ and system. Appreciating the full scope of these interactions requires a reflective, informed approach to medication use, one that balances immediate therapeutic goals with long-term cardiovascular integrity, and that recognizes the body's complexity rather than treating it as a series of isolated targets. Understanding this dynamic empowers patients and clinicians alike. It encourages curiosity, careful monitoring, and informed dialogue. It fosters the habit of questioning, of examining evidence from leading institutions, and of considering alternatives when risks outweigh benefits. By engaging in this reflective process, individuals over 50 can take control of their heart health, mitigating risks that might otherwise go unnoticed, and making choices that promote resilience, longevity, and the quiet confidence that comes from knowing the most vital organ is being protected thoughtfully, deliberately, and proactively. One of the most striking revelations from studies on medications and heart health is the subtle yet profound ways that certain commonly prescribed drugs can influence cardiac rhythm and function. These effects are not always immediately apparent, and they often emerge only after months or years of regular use, quietly affecting the electrical and structural integrity of the heart. Drugs that are taken for routine conditions, heartburn, pain management, sleep disturbances, or even psychiatric support, may interact with cardiac tissue, altering conduction pathways, ion channel function, or autonomic regulation. The multifaceted nature of these interactions makes them both complex to study and critical to understand. Older adults are especially vulnerable because their hearts are already subject to age-related changes, including reduced elasticity, slower conduction velocity, and less robust compensatory mechanisms. These subtle shifts in physiology mean that even minor pharmacological perturbations can precipitate serious consequences, including dangerous arrhythmias, impaired contractility, or sudden cardiac events. The second observation is that the nervous system plays a central role in how medications affect the heart. The autonomic nervous system regulates heart rate, blood pressure, and vascular tone, constantly adjusting in response to both internal and external stimuli. Certain medications, such as sedatives, hypnotics, and some antipsychotic agents, can alter autonomic signaling, creating an imbalance between sympathetic and parasympathetic inputs. This imbalance can lead to prolonged QT intervals, irregular pacing, or heightened susceptibility to ventricular arrhythmias. In older adults whose cardiac conduction systems may already be fragile, these changes can push the heart beyond its capacity for self-regulation. It becomes clear that the effects of drugs are not isolated to a single organ. They cascade through interconnected systems, influencing the relationship between neural input and cardiac response, which is why even drugs not directly intended for cardiovascular use can have profound cardiac implications. Third, the dosage and duration of medication use are critical factors in determining risk. Short-term, carefully monitored use may carry minimal consequences, but long-term or high-dose exposure can magnify the risk of adverse events. Proton pump inhibitors, for instance, widely prescribed for acid reflux, are generally considered safe. Yet studies suggest chronic use can lead to vascular changes, electrolyte imbalances, and increased risk of myocardial infarction. Similarly, certain long-acting opioids, while providing effective pain relief, have been linked to elevated cardiovascular mortality in older populations. These examples underscore that medication safety is context-dependent. It is not enough to know a drug is approved or commonly prescribed. Its effects must be considered in the context of the individual's age, comorbidities, and the cumulative stress placed on the heart over time. Regular reassessment and adjustment are therefore essential components of responsible, personalized care. The fourth insight involves the importance of patient awareness and proactive management. Many individuals accept medications without fully understanding the potential systemic effects, trusting that what is prescribed is inherently safe. However, evidence from large-scale studies and clinical observations suggests that older adults should take an active role in their cardiovascular health by reviewing all prescriptions with their healthcare providers. This includes asking about potential cardiac side effects, exploring safer alternatives, adjusting dosages, and scheduling periodic monitoring of heart function. A collaborative approach empowers patients, allowing them to participate in decisions that affect not only symptom relief, but also long-term cardiac integrity. Knowledge becomes a protective measure, transforming passive adherence into informed stewardship of one's health and reducing the likelihood of silent, progressive damage. Fifth, the interplay between medications, comorbid conditions, and lifestyle factors is profound. Older adults often manage multiple chronic conditions simultaneously, which increases the likelihood of drug interactions and cumulative stress on the cardiovascular system. Hypertension, diabetes, and mild kidney impairment can each modify how medications are metabolized and how they affect cardiac tissue. Additionally, lifestyle factors such as activity level, diet, sleep quality, and stress can either exacerbate or mitigate drug-related risks. This intricate web of influences highlights the importance of a holistic perspective. The heart is not affected by medications in isolation, but by the combined impact of biological, chemical, and behavioral factors. Addressing risk, therefore, requires a comprehensive approach that integrates pharmacological vigilance with attention to overall wellness and individualized care planning. Finally, understanding these dynamics emphasizes the delicate balance between benefit and risk inherent in all medical interventions. Medications are powerful tools that can improve quality of life, manage chronic illness, and alleviate suffering. Yet they are not without consequences, and their influence on cardiac health illustrates the complexity of human physiology. By examining research, asking informed questions, monitoring cardiac function, and considering alternative therapies, older adults can navigate this complexity with mindfulness and precision. The goal is not to create fear, but to cultivate awareness and proactive engagement, allowing individuals to preserve both the immediate therapeutic benefits of medications and the long-term integrity of their hearts. Through deliberate attention, reflection, and informed action, it becomes possible to reconcile the benefits of modern medicine with the need for cardiac protection, empowering older adults to move through daily life with greater confidence, security, and a sense of control over their own physiological destiny. The third observation emerging from research and clinical experience is that the cumulative effects of multiple medications on cardiovascular health are often underestimated, particularly in older adults who frequently take several prescriptions simultaneously. Polypharmacy, the use of multiple medications, is exceedingly common among individuals over 50. As doctors attempt to manage a constellation of conditions ranging from chronic pain and heartburn to insomnia, high blood pressure, and diabetes. Each medication taken individually carries a set of known risks and side effects, yet when combined, these drugs can interact in ways that amplify their impact on the heart, sometimes producing arrhythmias, increasing blood pressure variability, or impairing myocardial function. The challenge is that these interactions are often subtle and may not manifest immediately, making it difficult for patients and even clinicians to recognize early warning signs before they escalate into serious cardiovascular events. One critical aspect of polypharmacy is the overlapping influence on the body's metabolic and signaling pathways. Many medications are metabolized through the liver or excreted by the kidneys. And when multiple drugs are processed simultaneously, the efficiency of these systems can be compromised. Enzyme competition, altered drug clearance, and changes in electrolyte balance can all place stress on cardiac tissue. For example, certain pain medications may increase fluid retention, while some diuretics alter electrolyte concentrations, and sedatives can modify autonomic nervous system activity. Individually, these effects may be manageable, but together they can disrupt the finely tuned balance of heart rhythm, contractility, and vascular tone. In older adults whose organ systems may already be less resilient, This compounded effect can precipitate subtle but dangerous cardiac stress, often without obvious symptoms, until a critical threshold is reached. Another factor involves the influence of medications on cardiac electrophysiology. Many drugs, even those not primarily intended for heart conditions, can alter ion channel function, affecting how electrical impulses travel through the heart. When multiple medications with these properties are combined, the risk of arrhythmias and conduction abnormalities increases. QT interval prolongation, a measure of delayed electrical repolarization, is one such effect that can arise from the interaction of several commonly prescribed drugs, including some antibiotics, antihistamines, and sedatives. Prolonged QT intervals predispose individuals to ventricular arrhythmias, which can be life-threatening if not detected promptly. Older adults are particularly vulnerable because the natural aging of cardiac conduction tissue reduces the heart's ability to compensate for electrical disturbances, making careful monitoring essential for safety. Polypharmacy also has indirect effects on cardiac health through the cumulative impact on lifestyle and overall physiological resilience. Side effects such as fatigue, dizziness, and sleep disruption can reduce physical activity, impair balance, and exacerbate blood pressure fluctuations. Over time, these subtle disruptions can lead to reduced cardiovascular conditioning, increased stiffness of arteries, and diminished autonomic responsiveness, all of which make the heart more susceptible to stress. Furthermore, the psychological burden of managing multiple medications may create anxiety or stress responses that, through sympathetic nervous system activation, place additional strain on the heart. In this way, polypharmacy interacts not only with biological systems, but also with behavioral and emotional factors, highlighting the interconnectedness of health in older adults. The importance of awareness and communication in addressing these risks cannot be overstated. Patients who understand the potential cumulative effects of multiple medications are better equipped to engage in informed discussions with their healthcare providers. Reviewing all prescriptions regularly, questioning the necessity of each drug, considering non-pharmacological alternatives, and evaluating dosage timing can all reduce unnecessary cardiac stress. Clinicians, in turn, can use this information to tailor treatment plans that balance symptom management with long-term heart health, minimizing interactions and prioritizing medications with safer cardiovascular profiles. The proactive management of polypharmacy exemplifies the principle that health is not just about treating individual conditions, but about maintaining systemic integrity and resilience. Additionally, the role of regular monitoring is crucial in mitigating the effects of multiple medications on heart function. Electrocardiograms, blood pressure assessments, and periodic laboratory evaluations provide early detection of changes that may indicate elevated cardiovascular risk. When subtle warning signs are identified, interventions such as adjusting dosages, switching medications, or incorporating lifestyle strategies can prevent progression to more serious events. This approach reinforces the idea that vigilance and continuous evaluation are as important as the medications themselves, ensuring that treatment remains both effective and safe over time. The broader lesson is that medications, while invaluable for managing health conditions, are powerful agents that interact with the body in complex ways. In older adults, polypharmacy magnifies these interactions, placing the cardiovascular system under continuous and sometimes unrecognized stress. By cultivating awareness, seeking guidance from healthcare providers, monitoring both physiological and lifestyle factors, it is possible to mitigate these risks while still benefiting from the therapeutic value of medications. Understanding the cumulative effects of multiple drugs empowers older adults to navigate their treatment safely, maintaining both the quality of life and the integrity of the most vital organ in the body, their heart. Through thoughtful engagement, deliberate action, and ongoing vigilance, the hidden risks of polypharmacy can be transformed from a silent threat into a manageable aspect of health stewardship. Equally important in understanding the hidden dangers of commonly prescribed medications is recognizing the subtle ways in which they affect the structure and function of the heart over time. While acute cardiac events are often dramatic and immediate, much of the damage caused by certain drugs is insidious, developing quietly over months or years. Medications intended to alleviate common conditions such as pain, heartburn, or sleep disturbances can influence the heart on multiple levels, including vascular health, myocardial tissue integrity, and electrical conduction. The impact is often amplified in older adults, whose cardiovascular systems have already undergone age-related changes such as decreased elasticity of the arteries, stiffer heart muscle, and slower conduction through the atrioventricular node. These underlying alterations create a physiological environment where even subtle pharmacological stress can tip the balance toward dysfunction, making it essential to understand not only which drugs are involved, but how they interact with the complex mechanisms of cardiac health. One critical aspect of this process is the role of chronic inflammation and oxidative stress. Some medications, particularly certain pain relievers and long-term proton pump inhibitors, have been shown to influence inflammatory pathways, sometimes increasing systemic oxidative stress. This can compromise the integrity of the endothelium, the thin layer of cells lining blood vessels, reducing its ability to regulate blood flow and respond to changes in pressure. Over time, this contributes to arterial stiffness, impaired circulation, and higher cardiac workload. For the heart, which depends on the delicate balance of oxygen delivery and efficient contraction, even minor disruptions in vascular function can gradually lead to structural stress, hypertrophy, and vulnerability to arrhythmias. The cumulative effect of years of exposure to these subtle changes can be profound, often manifesting as unexplained episodes of palpitations, irregular heartbeats, or reduced exercise tolerance in older adults. Another dimension involves the way medications can alter the autonomic regulation of the heart. Certain sedatives, hypnotics, and some antipsychotic drugs interact with the autonomic nervous system, affecting both sympathetic and parasympathetic inputs. These pathways govern heart rate variability, cardiac contractility, and the body's response to stress. When autonomic balance is disrupted, the heart may respond less effectively to changes in posture, activity, or metabolic demand, increasing susceptibility to arrhythmias or sudden drops in blood pressure. Older adults are particularly at risk because age-related changes in baroreceptor sensitivity, heart rate variability, and conduction system resilience make the heart less able to adapt to these pharmacological influences. What may appear as normal fatigue or dizziness could in fact be a subtle signal of underlying cardiac stress-induced or exacerbated by medications, highlighting the importance of careful evaluation and monitoring. Electrolyte imbalances represent yet another mechanism by which commonly used drugs can compromise cardiac function. Diuretics, proton pump inhibitors, and certain long-term pain medications can alter levels of potassium, magnesium, and calcium, all of which are essential for maintaining stable electrical conduction and contractile function in the heart. Even small fluctuations in these electrolytes can disrupt the coordinated depolarization and repolarization of cardiac muscle, creating a fertile ground for arrhythmias. In older adults who may already have diminished renal function or reduced reserve capacity, these imbalances can occur more easily and have more pronounced effects. Monitoring electrolyte levels and adjusting medication regimens accordingly is a crucial preventive strategy, yet it is often overlooked in routine care, leaving subtle damage to accumulate silently. Medication-induced changes in metabolism and vascular tone also play a significant role in cardiac health. Certain drugs for diabetes or cholesterol management, while beneficial in controlling disease markers, can have unintended effects on endothelial function or lipid composition within arterial walls. These changes may accelerate vascular aging, promote atherosclerosis, or increase the likelihood of plaque instability. When combined with other medications that influence blood pressure, heart rate, or coagulation, the overall cardiovascular risk is magnified. This interplay underscores the need for a holistic understanding of pharmacology, one that considers not only the direct targets of a drug, but also its systemic effects, interactions with other medications, and the cumulative impact on an aging cardiovascular system. Finally, the psychological dimension of medication use cannot be ignored. Chronic conditions that necessitate long-term medication often bring stress, anxiety, or sleep disturbances, all of which can influence cardiovascular function. Some medications intended to relieve these symptoms may provide short-term benefits, but inadvertently alter heart rate variability, blood pressure, or vascular responsiveness. The interplay between mind, medication, and heart demonstrates that cardiovascular health is not isolated to the physical structure of the heart, but is influenced by neurochemical and behavioral factors as well. Addressing this requires a comprehensive approach that combines awareness of drug-related risks with lifestyle strategies, stress management, and regular cardiac monitoring. Through careful consideration of these mechanisms, vascular stress, autonomic disruption, electrolyte imbalance, metabolic effects, and psychological influences, it becomes evident that certain medications carry risks that are subtle, cumulative, and particularly relevant to older adults. Understanding how these drugs interact with the heart at multiple levels empowers patients and clinicians to make informed decisions, adjust therapies, and monitor for early signs of dysfunction. In this way, the hidden dangers of common medications can be managed thoughtfully, allowing individuals to benefit from their therapeutic effects while minimizing potential harm and preserving the integrity and resilience of the heart over time. The fifth and perhaps most profound realization when examining the effects of commonly prescribed medications on older adults is the crucial importance of proactive engagement and informed decision-making in safeguarding heart health. Many individuals over 50 assume that the medications in their cabinets are inherently safe, relying on them to manage chronic conditions, alleviate pain, or support sleep. Yet the growing body of evidence from cardiac research demonstrates that even routine drugs can have serious cardiovascular consequences, particularly when used long-term or in combination with other medications. This underscores a critical truth. Medication safety is not a passive state, but an active process that requires awareness, vigilance, and continuous collaboration with healthcare providers. Older adults are uniquely positioned to benefit from such proactive strategies because age-related changes in metabolism, cardiac conduction, and vascular resilience make the heart more susceptible to subtle, cumulative stress. Engaging with these realities empowers individuals to take control of their own well-being, rather than leaving it solely in the hands of prescription routines or assumptions about safety. The first aspect of proactive engagement is understanding the mechanisms by which common medications influence cardiac function. Drugs for heartburn, pain, sleep, and other everyday conditions often act on systems that indirectly affect the heart. Pain medications may alter vascular tone or promote fluid retention. Sedatives can influence autonomic regulation. Proton pump inhibitors may affect endothelial function and vascular health. These effects individually may be manageable, but when combined with age-related physiological changes, they can increase the likelihood of arrhythmias, sudden cardiac events, or progressive myocardial strain. By comprehending these mechanisms, patients gain insight into why routine medications may carry hidden risks and why careful monitoring and periodic reevaluation are essential components of a safe medication strategy. Knowledge transforms fear into informed awareness, creating a foundation for deliberate and confident action. Another crucial component is cultivating a habit of systematic review and questioning. Older adults often take multiple prescriptions, sometimes prescribed by different specialists, making it difficult to see the cumulative impact on the heart. Taking the initiative to review every medication with a trusted healthcare provider helps uncover potential interactions, overlapping side effects, and unnecessary prescriptions. Asking targeted questions about cardiac risk, exploring safer alternatives, and discussing dosage adjustments fosters a sense of agency, transforming what could be passive adherence into active participation in health management. Regular review is not merely procedural. It is a protective strategy that empowers individuals to minimize preventable harm while maintaining therapeutic benefits. Monitoring and measurement are equally vital. Regular cardiovascular evaluations, including electrocardiograms, blood pressure assessments, and laboratory tests, provide early detection of subtle changes that might indicate medication-related stress on the heart. These assessments allow clinicians and patients to intervene proactively, adjusting medication regimens, introducing lifestyle modifications, or selecting safer alternatives before significant damage occurs. Any older adults who may be more vulnerable to silent changes in cardiac function, such monitoring is essential. It enables early identification of arrhythmias, electrolyte imbalances, or vascular stress, reducing the likelihood of sudden events and reinforcing the principle that prevention is often more effective than reaction. Lifestyle integration is another essential element of minimizing medication-related cardiac risk. Exercise, balanced nutrition, stress management, and adequate sleep all influence heart health, modulating the impact of medications on vascular and myocardial function. Engaging in regular physical activity, for example, enhances circulation, supports autonomic balance, and strengthens the cardiovascular system's resilience. Proper nutrition helps maintain electrolyte balance, vascular integrity, and metabolic stability. Together with informed medication use, these lifestyle strategies create a synergistic effect that reduces the heart's susceptibility to drug-related stress. Older adults who combine these practices with regular consultation and careful monitoring achieve a greater degree of protection than reliance on medications alone can provide. The psychological dimension of proactive engagement also warrants attention. Living with chronic conditions often carries stress, anxiety, and the burden of long-term medical management. This mental and emotional load can interact with the physiological effects of medications, influencing heart rate variability, vascular tone, and overall cardiac resilience. By cultivating awareness, practicing mindfulness, and engaging in proactive health management, older adults can reduce this psychological burden, indirectly supporting heart health. Feeling empowered to question prescriptions, monitor physiological markers, and make informed choices fosters confidence and reduces the sense of helplessness that can accompany chronic medication use. Finally, the principle of collaboration between patient and clinician is fundamental. No one individual can fully assess all potential risks of complex medication regimens alone. Shared decision-making ensures that the benefits of each prescription are weighed against potential cardiovascular risks, and that interventions are tailored to the specific physiological context of the patient. This partnership emphasizes that safe medication use is not about fear or avoidance, but about careful, informed, and intentional management. Each prescription becomes a deliberate choice rather than a default action, balancing symptom relief with the preservation of cardiac function and overall health. Through this proactive, informed, and collaborative approach, older adults can transform what might appear to be hidden threats into manageable aspects of health stewardship. By understanding mechanisms of action, reviewing medications regularly, monitoring cardiac function, integrating supportive lifestyle practices, and engaging collaboratively with clinicians, patients gain both control and confidence. The heart and organ continuously exposed to the cumulative effects of aging and pharmacology can be protected not through avoidance alone, but through mindful engagement, continuous vigilance, and thoughtful decision-making that ensures medications serve their intended purpose without compromising long-term cardiovascular integrity.